When a liver is severely damaged, it creates a roadblock for blood flow. To relieve the pressure, the body starts weeping fluid into the empty space of the belly, causing it to swell. Doctors call this trapped fluid ascites. Arriving at the hospital with a suddenly swollen abdomen is frightening. Often, the whirlwind of tests and medical jargon that follows only adds to that stress. Behind the scenes, the medical team uses this flowchart. This is the official guide for managing the condition, and it can look like a wall of dense text and complex terms. However, the entire document follows 4 simple steps. Understanding these steps reveals the logic behind every decision the medical team makes. Looking at the first box on the chart, step 1 is the initial evaluation. Before starting any treatment, doctors have to test the fluid itself. To do this, they safely guide a small needle into the belly to draw out a tiny sample of the trapped liquid. The doctors are looking for infection. Trapped liquid is a perfect breeding ground for bacteria, and the medical team needs to know immediately if there is a hidden danger growing inside. The guide is so strict about getting this sample quickly that it includes a warning right here. It instructs doctors not to wait for routine blood clotting tests, because the fluid analysis is the priority. Proving the fluid is clear of bacteria is the only way to safely move forward. Testing first ensures the medical team has the information they need before they act. In the center of the chart, we find step 2, grading the severity. Doctors rank the swelling on a scale from 1 to 3 to choose the right treatment path. Grade 1 is minor enough that it only shows up on an ultrasound. The critical decisions begin at grade 2, where the swelling is visibly obvious. For a grade 2 case, the strategy relies on a sponge and drain approach. It begins with the patient's diet, specifically by strictly limiting salt. Think of dietary salt like an internal sponge. The more salt there is in the body, the more water that sponge traps and holds onto, which increases the swelling. By removing the salt, the body stops holding that water. Then, doctors add in water pills, which tell the kidneys to flush that excess fluid out of the body as urine. The grade 2 path relies on gently changing the body's internal chemistry to slowly reverse the flooding without needing surgery. At grade 3, the belly is severely swollen and tight. In these cases, pills alone will not work fast enough. To fix this, doctors perform a procedure to physically drain the fluid. They use a special tool to remove large amounts of liquid in a single session. While this provides instant relief, it creates a new challenge. Draining so much fluid so quickly causes a sudden drop in internal pressure, which can cause the kidneys to panic and fail. To prevent that, the guide has a mandatory rule. As fluid is drained, doctors must drip a specific protein called albumin into the bloodstream to keep the internal pressure stable. Because the kidneys are so vulnerable, common painkillers like ibuprofen are strictly forbidden. These medications can trigger kidney failure during this critical time. Treating severe swelling is a careful balancing act, draining the fluid from the liver while actively shielding the kidneys. While these steps clear the fluid and relieve the pain, they do not repair the underlying damage to the liver. This leads to step 4. When a patient develops this level of swelling, it indicates the liver is failing, which triggers an evaluation for a liver transplant. The playbook is complete. Test the fluid, grade the swelling, treat the cause, and protect the kidneys throughout the process. This logical design guides patients out of an immediate crisis and toward a long-term cure.